If your eye doctor mentioned vitrectomy, it means surgery is needed inside the back of your eye. Vitrectomy removes the clear jelly, called vitreous, that fills the back of the eye so the surgeon can reach the retina. Doctors commonly perform vitrectomy for retinal detachment, bleeding from diabetes, macular holes, and scar tissue on the retina. Surgery is usually urgent for fresh retinal detachments, but can be planned for stable conditions like epiretinal membranes. Most vitrectomies use local anesthesia with sedation. You stay awake but relaxed, feeling no pain during the operation. The surgeon makes 3 tiny openings in the white of the eye, one for fluid, one for light, and one for instruments. A fine cutter removes the vitreous piece by piece. The surgeon then repairs the retina with laser or delicate peeling. The eye is then filled with saline, a gas bubble, or silicone oil to support healing, depending on the case. When a gas bubble is used, surgeons often ask patients to keep their face down for several days so the retina can heal in place. Air travel must be avoided while a gas bubble is in the eye because altitude changes can dangerously raise eye pressure. Vision clears gradually. Most patients return to normal activities in 4 to 8 weeks, with final vision settling over months. Most adults who have not had cataract surgery will develop a cataract within a few years. It is treated with a standard operation. Timing matters. Studies show retinal conditions treated sooner generally have better vision outcomes than those left too long. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.